am Dr. Shefali Bansal Madhav, Consultant Fertility Specialist at New Life Fertility Center, Siliguri. Today we will talk about a very common health problem, that is polycystic ovary or PCOS. Polycystic ovary affects almost 10% of the females in the reproductive age group between the age of 15 to 45 years. Now, what is polycystic ovary? It is basically a hormonal disbalance which affects the regular menstrual cycle of the female. We know that in a healthy menstrual cycle, there is a regular ovulation every month. But in polycystic ovary patients, this regular ovulation doesn't happen. So what are the symptoms of polycystic ovary? These patients generally present to us with delayed periods or irregular menstrual cycles. The menstrual cycles may be delayed from 45 days up to 6 months or even up to 1 year in severe polycystic ovary patients. Generally, these patients may complain of weight gain, that is obesity. They may have increased facial hair like abnormal hair growth on the chin, lips or other parts of the body where usually men have hair. They may also complain of acne and other signs of hirsutism. So how do we diagnose a patient of polycystic ovary? Usually, when the patient comes to us, the patient may give different types of history. Sometimes she may just come to us with menstrual irregularity like delayed periods, or they may have the history of hirsutism, acne, thinning of hair or weight gain. And most of the times the patient comes to us with infertility. So what do we do when we get a polycystic ovary patient? First of all, we go for a detailed history regarding her menstrual cycles. Then we go for a physical examination where we check their blood pressure, height, weight. We calculate their body mass index to see if they are in the obese category. Then we see the signs of hirsutism like increased facial hair and acne. Then we go for certain hormone tests. For example, thyroid hormone, prolactin hormone and certain special hormone tests like LH and FSH which have to be done on 2nd or 3rd day of the cycle. Generally, these patients may have high androgen levels. So what are androgen hormones? They are male hormones which are normally produced in some amount even in healthy females. But in polycystic ovary females, these androgen hormones may be produced in excess amount which leads to increased facial hair and acne, thinning of scalp hair and hirsutism. So these kind of patients may also have high insulin levels, that is, the insulin doesn't act on the body cells. So they may have high insulin levels, and because of these hyperinsulin levels and high androgen levels, the ovaries, they do not produce regular ovulation. So whenever we have 2 out of 3 criteria which are positive in any patient, we can diagnose a patient as a polycystic ovary. Out of these 3, that is menstrual irregularity, signs of hyperandrogenism, that is hirsutism, and we also do an ultrasound to see if there is a polycystic pattern of ovary on the ultrasound. These cysts are basically immature eggs which can be seen as a pearl of necklace like pattern in the ovary. So if we have 2 out of these 3 criteria positive, then we can label the patient as a polycystic ovary. So how do we manage these patients of PCOS? The symptoms will guide us whether the patient has come only for menstrual irregularity or she has come for infertility, and the other important thing is to prevent the long-term health risks of the PCOS. So first of all, the patient will ask us, what can I do to improve my symptoms? The most important thing that we tell the patient is to lose some weight. Usually, even if the patient loses about 10 to 15% of her present body weight, it may help to bring down the excess hormones and resume the normal menstrual cycles. To lose weight, we guide the patient to follow healthy dietary habits and regular physical exercise and a modified lifestyle. Sometimes we may add medication like OC pills or birth control pills to regularize the menstrual cycles. These birth control pills have many benefits. Apart from regularizing the menstrual cycles, these birth control pills may also reduce the androgen levels, and they may also help to bring down the high LH levels which is usually found in these polycystic ovary patients. Apart from that, we may also add insulin sensitizers, which will improve the insulin sensitivity of the body cells, and they will help to improve the ovulatory function when given for a long time. Now, especially if the patient has come to us for fertility concern, these patients will require ovulation induction, because we know that a normal PCOS patient will not have an ovulatory cycle. The first line of therapy is generally medicine. We give medicines to improve the ovulation, and we go for follicle monitoring to check whether the follicles are improving in size, whether the mature follicles are developing by an ultrasound method. So once we see that the mature follicle is developing, we tell the patients to try naturally. Even after a couple of cycles, if the ovulation doesn't happen, then we may label this patient as a resistant PCOS. So what do we do if the patient is a resistant PCOS? The second line of treatment for these kind of patients is to go for injectable gonadotrophins, which can be added to the medication, and most of the patients will have ovulation after adding the injections. What happens if the patient has regular ovulation but still fails to conceive even after trying many cycles of IUI or natural trial? So these patients we further evaluate for other causes of infertility like male infertility or tubal blockage, and then if other factors are normal, then sometimes these patients may have to be stepped up to a higher treatment like a IVF or a test tube baby treatment. In IVF treatment, higher dose of gonadotrophins is started from day 3 of the cycle, and we get more number of follicles. These follicles or eggs are taken out of the body of the female, and they are fertilized with the husband's sperm in the laboratory. And the embryos are formed in the laboratory. Then good embryos are selected from the embryos in the laboratory, and they are transplanted into the mother's uterus. So are there any other methods? Sometimes when there is a thin PCOS, if there is a high LH level and she is resistant to regular methods, we may opt to go for laparoscopy, which is a surgical method in which we do laparoscopic ovarian drilling. In this method, small holes are punctured into the ovarian cortex, because the ovarian cortex is quite thick in these patients, and by drilling holes, that is called ovarian drilling, we can bring down the LH hormone, and sometimes the patients may resume normal ovulation after the laparoscopic ovarian drilling. So are there any specific risks of these patients once they become pregnant? During pregnancy, generally polycystic ovary patients may require progesterone supplementation, which is a hormonal supplementation, because they may be deficient in progesterone hormone. During first trimester of pregnancy, polycystic ovary patients may have higher risk of miscarriage. During second or third trimester, these patients may have higher risk of diabetes or even hypertension, and they may have a higher chances of going for cesarean section. If the mother has diabetes during pregnancy, which is called gestational diabetes, sometimes the child or the baby can have a high birth weight, that is macrosomia, and the baby may have higher chances of getting admitted into NICU. So what can the patients do to prevent these complications? Generally, pre-pregnancy counseling is very important for these women. Maintaining ideal body weight before planning pregnancy by cutting down on their dietary habits, by improving their modifying their healthy lifestyle, and having a regular physical exercise, maintaining a healthy pre-pregnancy body weight can reduce the complications of PCOS during pregnancy. Apart from this, increase folic acid supplementation before pregnancy can also reduce the risks. So are there any long-term health risks of these PCOS? Sometimes after the age of 40 or 45, these women may have higher risk of developing diabetes, hypertension, heart disease, sometimes endometrial carcinoma, but these risks can be minimized if the patients start at very young age and maintain healthy lifestyle, avoid weight gain, and maintain their body weight. So in short, I would like to summarize that PCOS is a common health problem which affects many females, about 10% of the females in reproductive age group. So there are many lifestyle modifications and medications by which the PCOS women can be helped, and if treated properly, they have a very high success rate for infertility. Thank you.